Thinking about starting a home healthcare agency in Arizona? You're in the right place. With a booming senior population and rising demand for in-home care, Arizona is one of the best states to launch your healthcare business. Here's your step-by-step guide to getting licensed and building a thriving, compliant agency. Step 1. Register your business. Choose your structure LLC or corporation and register with the Arizona Corporation Commission. This gives you legal standing to operate. Step 2. Get an EIN. Apply for an employer identification number through the IRS. You'll need it for taxes, banking, and hiring. Step 3. Secure a physical office. Arizona law requires a physical office. Make sure it's compliant and accessible. This is your administrative hub. Step 4. Apply for licensure. Submit your application to the Arizona Department of Health Services. Include details about your business, services, and required documents. Step 5. Create policies and procedures. Build thorough policies aligned with state and federal rules. These outline how you operate, serve clients, and manage your team. Step 6. Get a national provider identifier. This number allows you to bill Medicare, Medicaid, and insurers. Apply through the National Plan and Provider Enumeration System. Step 7. Insurance coverage. Protect your business with liability insurance and workers' compensation. This safeguards both your agency and your team. Step 8. Hire qualified staff. You'll need certified nurses, aides, and trained personnel. Staff compliance is critical to maintaining quality and passing inspections. Once licensed, don't stop there. Maintain compliance through ongoing training, quality checks, and annual renewals. Starting a home healthcare agency isn't just about business, it's about impact. You're building a service that empowers people to heal and live with dignity right in their own homes. Want help navigating the process? CarePolicy.us offer tailored policies and expert guidance to ensure you're inspection ready from day one.